So we have an update on the absolute collapse of the CDC that took place the other day. Like in just a span of 24 hours, you had the director get fired, and then at least four other high-level officials who've been there forever resign in protest. And it's getting worse, man. It's getting worse. The CDC is about to just collapse. Let me tell you why. So, the previous director, that she was only director officially for a month, but she was the acting director since like January 23rd, shortly after Trump took office. So, and that was Susan Monarez. And you know, looking at her background on paper, very, very reasonable. And one of the probably only qualified people to actually step foot in this administration in regards to the job they're supposed to do. And she was like the first CDC director without like a medical degree since 1953, but the degree she actually had was like a PhD in infectious diseases and like emerging technologies in how to use them to combat the spread of diseases. So like, it was kind of interesting. And I said this, that like if this was someone under a normal administration, like any other administration, one that's not anti-science and anti-medicine, and she would have a sense of independence, I would be like, she might actually be pretty good. But like I'm instantly skeptical of anyone who is actually appointed by this administration because are pretty much loyalist yes men. But that wasn't really the case for her, and as a result, a month later, she got fired. So we're going to talk about her replacement, at least for now. It's a guy by the name of Jim O'Neill, and oh boy, this may be one of the this is straight up the most unqualified person to ever lead the CDC, probably as a director or otherwise. He's a hedge fund manager. He's an investor. His education, he has like a bachelor and a master's in humanities. He has no experience in this field. This article mentioned that he worked under the Bush administration for the Department of Health and Human Services, but it was what was it? A speech and editorial division of the U.S. He was the director of that. Like, okay. Anyways, I digress. Let's get into this story. So, Kennedy expected to name Deputy Jim O'Neill as acting CDC director after Monarez ouster, sources say. Real quick, before we get into this, if you are new to the show, please hit that subscribe button. It is completely free, and each and every one, it just means the world. I can't put into words just like, how good it is to see that number go up every now and then. I cover the news every single day. I'm not here to push you into one party or the other. I'm here to push you into a reasonable set of policy goals. I like to actually call them real common sense policies, like free healthcare, free higher public education, a minimum wage that you can actually live off of if you're working full time, and of course, complete public infrastructure reform. All of this may sound radical here, but it is just standard operating procedure in pretty much all of our peer nations. And, that it shouldn't be like that. So if you support that message, hit the subscribe button. Even if you don't support that message, you want to hate watch, you want to debate, call each other names in the comments, maybe one day I can push you to one of these positions. So you're welcome aboard as well. Anyways, without further ado, Deputy Secretary of Health and Human Services Jim O'Neill is expected to serve as acting director of the U.S. Center for Disease Control and Prevention, according to an administration official and another person familiar with the matter. O'Neill joined HHS in June after years as a Silicon Valley-based technology and biotech investor, including stints with the Peter Thiel. Is it Thiel or Thiel? I don't really care. The crazy guy who's like, looks like a blood-sucking vampire who can't like answer if humanity deserves to exist or not. The dude who's the head of the database that's going to track everything and anything about you, Palantir, that guy. So he's very closely involved with him in the Thiel Fellowship, a grant program for young entrepreneurs started by billionaire Palantir founder Peter Thiel. I should have just kept reading. O'Neill has also worked for HHS during the George Bush administration, as I mentioned. They have here as Principal Associate Deputy Secretary. He led changes to food regulation and emergency response. Wikipedia said he was like the director of what I said earlier. So either way, This guy isn't qualified to be director of the CDC regardless. The Washington Post first reported O'Neill's new role. He assumes the role amid turmoil for the CDC in the wake of Director Dr. Susan Monarez's firing and a series of high-profile resignations this week. Agency employees rallied outside the CDC's Atlanta headquarters on Thursday to salute the departing Dr. Deborah Hourly, former Chief Medical Officer Dr. Dimitri Daskalakis. Love that name. Daskalakis. Yeah, good name. Former Chief of Vaccines and Respiratory Diseases, Dr. Daniel Jernigan, Director of the National Center for Emerging and Zoonotic Infectious Diseases, and Data Chief, Dr. Jennifer Layden. O'Neill accompanied Monarez and HHS Secretary Robert F. Kennedy Jr. on a tour of the CDC campus this month after a gunman opened fire there, pocketing the buildings with hundreds of bullets holes and killing DeKalb County Police Officer David Rose. At his confirmation hearing in May, O'Neill told Senator Bill Cassidy, a Louisiana Republican, that he's very strongly pro-vaccine. I'm an advisor to a vaccine company. I support the CDC vaccine schedule. Cassidy then asked O'Neill specifically about mandates. Do you agree with the mandate which currently exists, that if somebody wishes to become a legal resident, that they must be up to date on their immunizations as per recommended by the CDC? O'Neill said, I haven't looked into the immigration law aspect of this, but I do support the CDC schedule, and that rule seems reasonable to me. Dude's lying through his teeth, man. Dude is lying through his teeth. The first, anti-vaccine mandate or anti-vaccine policy that RFK hands to him, he's going to rubber stamp it. He's going to rubber stamp it in a heartbeat. What are we doing here? He also told senators that he would help reform outdated rules and pursue transparency within federal health agencies. Yeah. When this administration says transparency, they just mean hey, maybe you'll get a scheduled or a leaked signal chat every now and then. Our health care system is difficult to navigate, and it prioritizes pills over prevention. Oh, God. Providers spend too much time clicking through pop-up screens and fighting with insurance companies instead of looking into the patient's eye. I do agree with that. Federal policies can empower people to break this cycle, O'Neill said. If confirmed, I'll help reform outdated rules, pursue transparency and gold standard science, and champion healthy lifestyle and prevention to Americans can thrive, so Americans can thrive, a.k.a., actual pharmaceutical meds. You don't need them. You don't need them. You're depressed, or you have some blood pressure problems, or I don't know, some kind of thing you need to manage with medication. No. You don't need to do that. You see, you just need to do some push-ups and some pull-ups and walk a couple miles every day and eat right and drink your Blue 40, whatever the hell RFK has been chugging. But yeah, okay. I have no hope for this guy. Susan Monarez, I at least granted that she was qualified. She was definitely qualified. I just thought that qualification wouldn't mean anything because she was just going to be a yes woman to RFK Jr. I was proved wrong, and as a result, she was quickly ousted. So yeah, what do you think? What do you think of this fucking jerk off fucking? Oh, God, if he's really close with Peter Thiel, is he going to, oh, God, all your medical data going straight to Peter Thiel and his Palantir database. Good luck. But yeah, let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below, and if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.